This Yale University neurologist just said that acupuncture does not work, and I could not disagree anymore. However, the reason I'm making this video is because that there are a lot of conditions out there that can be resolved with alternative medicine. Now, acupuncture is very powerful. It can help with many things, but not everything. I'm only here to provide a different point of view to really showcase whether or not this traditional Chinese medicine is actually as bad as they say it is, and if this acupuncture actually works or not.
You guys ready? All right, let's watch it.
It doesn't matter where you stick the needles.
Pause. It does, but I'll get into it in a bit.
It also doesn't matter if you stick the needles.
That's literally the point, guys. That's literally the whole point of acupuncture. Anyway, we'll get into it.
What the evidence shows is that acupuncture is essentially an elaborate placebo. You get a placebo effect out of it, and that is all. You get no specific effect out of the acupuncture itself. Acupuncture, which is defined as inserting needles, acupuncture needles, into acupuncture points.
So first part, I disagree, but the second part, yes. Okay, he's making sense here.
That are supposed to relate to the symptomatology, whatever symptoms you're trying to treat. The clinical research clearly shows...
First of all, we're not trying to treat the symptoms. If most people out there know what we're doing, we're collecting a bunch of symptoms and then forming it into a pattern diagnosis, okay? And once we have that pattern, we then tailor a combination to your concern based around your pattern to treat that pattern to help resolve the symptoms.
After literally thousands of studies, that it doesn't matter where you stick the needles. It also doesn't matter if you stick the needles. You could randomly poke somebody with toothpicks, and some studies literally do that, and that's just as effective as doing all the things that an acupuncturist is.
Yep, this point I have to clarify. Yes, to some extent what he's trying to say, this is what we call sham acupuncture. Sham acupuncture is the stimulation of the needles, and I'll tell you this. Personally, if that's the case, I wouldn't be getting paid at all. So to some extent, I don't know what he's talking about here with this sham acupuncture. Never experienced it in my personal clinic at all. However, let me get into it more. We'll just have a look at it.
Supposed to do. If they're equally effective, what does that mean? I interpret that to mean that acupuncture, sticking needles in acupuncture points, doesn't work because you don't have to do it. You don't have to stick the needle. Saying that acupuncture works because there is a placebo effect would be like a pharmaceutical company saying, well, our drug and the placebo worked better than no treatment at all in clinical trials. Therefore, both our drug and placebo work. It's not proper logic of science and evidence. It's not science-based medicine.
True. To some extent, yes, I agree. It's not really science-based because guess what? Acupuncture cannot be caged into the realm of science. It's a holistic health treatment, okay? So what it means by holistic health, meaning that it is not a system that can be compared to science. They're two different realms of kind of like logic. Because in Chinese medicine, we say your liver is hyperactive. Doesn't mean that suddenly there's something like your liver cirrhosis or you have issues with your liver. Acupuncture cannot be put into trials and studies to be compared whether or not it works or not. Because guess what? Let's just say in this study, they say, does acupuncture work for lower back pain? Did you know that there are multiple types of lower back pains out there? You can't do the same points for different types of lower back pain. There's literally back pain from your period. There's back pain that because you're an old person, you can't get up, you just feel weak. You have back pain because you hit the gym too much. You have back pain because you have digestion problems. You cannot use the same treatment to treat different types of lower back pain if this was in a study. You can't put acupuncture or traditional Chinese medicine, a holistic health approach where we use completely different systems and compare it to science. It just doesn't work like that because there's so many things in science we don't know yet and we haven't discovered yet, and we're not that advanced. How many times have I seen a patient that tells me that their blood tests are completely fine and guess what? They still feel sick. Okay, moving on.
The bottom line is, and we have thousands of studies now to demonstrate this, acupuncture doesn't work for any indication.
I'll tell you this. Whether or not acupuncture works or doesn't work, in my personal experience, there's two main factors, okay? Let's go with the obvious one, number one. If you are really, really sick beyond measure, because acupuncture uses your own strength to heal yourself. If you can't, if the illness is that bad, you cannot use acupuncture. You have to have some sort of conventional medicine to use as the foundational support, and I'm not against it. You have to have it. Number two, if the acupuncture points are not working, that's because your practitioner didn't get the right diagnosis. They didn't take your pulse or probably looked at your tongue or asked all the questions and tailored a bunch of points suited to you. And therefore, they used generic points to help with your illness. For example, when I target back pain today in my clinic, I did not use the same points for every single one of my patients. Sometimes I target it through the legs, sometimes I target it through the stomach, and sometimes I target it through the head. It's completely based on the pattern. Now, you may be thinking, why would you target different points in the hands and the feet and legs for back pain? It's because that back pain has its own pattern, and I diagnosed the pattern and I treated accordingly. Therefore, each individual will have a tailored treatment based to them.
So regarding the sham acupuncture, I'm going to confront it head on and just be honest, I don't know. Maybe he does have a point, and maybe it is true. Because I'm not a researcher. I'm not someone that knows anything in this field. But if you look at it, there's so many acupuncture locations still open to this day, and still in China, they use it frequently in their own medical system. So if it doesn't work, why is it still there? Because if I told you, hypothetically speaking, if I can assist your lower back pain with 3 sessions of acupuncture instead of possibly pain medication for months and months on end without a solution, think about it. Just think about it. However, the opposite can happen as well. So I'm not saying that acupuncture doesn't just work for everything. If you find the right acupuncture points but wrong point combination, you'll be in trouble. They'll feel worse afterwards. So it's not just acupuncture makes things better, it can also make things worse. It's just about the point combination. And most importantly, if it's the right medical condition to work with. Thanks for hearing me ramble on about whether or not acupuncture works. If you really want to know, go try it for yourself. And most importantly, find someone that is reputable and highly reviewed, or even just ask around. You never know. Worst case scenario, you just waste a bit of money. However, you never know what might happen. Give it a shot and take care. Thanks for watching the video. Peace.